Skin moles are small, colored spots on our skin. They can appear anywhere on the body and are usually round or oval in shape. These spots are often darker than the surrounding skin, making them easily noticeable. They happen when skin cells, known as melanocytes, grow in a cluster instead of spreading out evenly. Melanocytes are responsible for producing melanin, the pigment that gives our skin its color. When these cells group together, they form a mole. Most moles are harmless and very common. In fact, it's normal for an individual to have between 10 to 40 moles by adulthood. These moles can appear on anyone, regardless of age, gender, or ethnicity. They can be flat or raised, and their color can vary. Some moles are smooth to the touch, while others might be rough or have hair growing from them. The texture and appearance of moles can differ greatly from one person to another. Some moles are present at birth, known as congenital moles, while others appear later in life, often during childhood or adolescence. These are called acquired moles. It's not uncommon for new moles to develop as we age. Moles are usually brown or black, but they can also be pink, tan, or even colorless. The color of a mole can depend on various factors, including the amount of melanin in the skin and the depth of the melanocytes within the skin layers. They come in different sizes, but most are smaller than a pencil eraser. However, some moles can grow larger over time. It's important to note that the size of a mole doesn't necessarily indicate whether it's benign or malignant. While most moles are benign, it's essential to keep an eye on them for any changes. Changes in size, shape, color, or texture can be signs of skin cancer, such as melanoma. Regular self-examinations and dermatologist checkups are crucial for early detection and treatment. To help monitor moles, dermatologists recommend using the ABCDE rule: A for asymmetry, B for border irregularity, C for color variation, D for diameter larger than 6 millimeters, and E for evolving over time. If you notice any of these signs, it's important to consult a healthcare professional. Protecting your skin from excessive sun exposure can also help prevent the development of new moles and reduce the risk of skin cancer. Wearing sunscreen, protective clothing, and seeking shade are effective ways to safeguard your skin. Embracing and understanding your skin, including its moles, is an important part of overall health. By staying informed and vigilant, you can ensure that your skin remains healthy and beautiful. Common moles are the most frequent type of mole. They are typically small, round, and evenly colored. These moles are harmless and usually don't require treatment. Common moles can appear anywhere on the body, but they are often found on areas exposed to the sun. They might be flat or slightly raised, feeling smooth or slightly bumpy to the touch. Atypical moles, also known as dysplastic nevi, look different from common moles. They might be larger, have irregular borders, or have a mixture of colors within them. While most atypical moles are benign, they have a slightly higher chance of developing into melanoma, a type of skin cancer. It's crucial to have atypical moles checked by a dermatologist regularly. Congenital moles are present on the skin from birth. They can range in size from small to very large. Large congenital moles might have a slightly higher risk of developing into melanoma than smaller ones. If you have a congenital mole, especially a large one, regular checkups with a dermatologist are recommended to monitor for any changes. Most moles are harmless, but some changes in moles can be a sign of skin cancer, especially melanoma. Melanoma is a serious type of skin cancer that can spread to other body parts if not detected and treated early. Paying attention to any new or changing moles is essential. If you notice any of the ABCDEs of melanoma, it's crucial to see a dermatologist promptly. Early detection is key in treating melanoma successfully. Monitoring your moles is an essential part of maintaining skin health. By keeping a close eye on any changes, you can catch potential issues early. One of the most effective ways to do this is by using the ABCDE rule. This simple guide can help you identify any suspicious changes in your moles that may require further examination by a dermatologist. The ABCDE rule is a helpful guide to monitor your moles for any suspicious changes. Each letter in the ABCDE rule stands for a specific characteristic to look out for. By familiarizing yourself with these characteristics, you can better understand what to watch for and when to seek professional advice. Let's break down each component of the ABCDE rule to give you a clearer picture of what to look for. Asymmetry. One half of the mole does not match the other half. This means that if you were to draw a line through the middle of the mole, the two halves would not be mirror images of each other. Asymmetry can be a warning sign that the mole is not benign and should be checked by a dermatologist. Border. The edges of the mole are irregular, blurred, or notched. A healthy mole typically has smooth, even borders. If you notice that the edges of your mole are uneven, it could be a sign of melanoma. It's important to have any moles with irregular borders examined by a professional. Color. The mole has different shades of brown, black, tan, red, white, or blue. A mole that is uniform in color is usually not a cause for concern. However, if you notice multiple colors within a single mole, it could be an indication of skin cancer. Pay attention to any moles that have a variety of colors and bring them to the attention of your dermatologist. Diameter. The mole is larger than 6 millimeters across, about the size of a pencil eraser. While size alone is not a definitive indicator of melanoma, larger moles are more likely to be problematic. It's a good idea to measure your moles and keep track of any that are larger than 6 millimeters. If you notice a mole growing in size, it's time to get it checked. Evolving. The mole is changing in size, shape, color, or height. Any noticeable changes in a mole over time can be a red flag. This includes changes in elevation, texture, or any new symptoms such as bleeding or itching. Keeping a record of your moles and noting any changes can be incredibly helpful for your dermatologist in assessing your skin health. Remember the ABCDE rule and examine your skin regularly. Regular self-examinations can help you catch any changes early. Make it a habit to check your skin once a month, using a mirror to examine hard-to-see areas. If you notice any changes that match the ABCDE criteria, don't hesitate to make an appointment with your dermatologist. Early detection of any changes can be crucial in ensuring timely treatment. Skin cancer, when caught early, is highly treatable. By using the ABCDE rule as a guide, you can take an active role in monitoring your skin health and catching potential issues before they become serious. Always consult with a dermatologist if you have any concerns about your moles or skin changes. Your vigilance can make a significant difference in your overall health and well-being. Moles are common skin growths that most people have. While most moles are harmless, it's important to be aware of any changes that might indicate a potential problem. Apart from the ABCDE rule, which stands for asymmetry, border, color, diameter, and evolving, other changes in moles can also signal a potential problem. The ABCDE rule is a helpful guideline, but it's not exhaustive. These include a mole that becomes itchy. Itchiness can be a sign that something is irritating the mole, and it shouldn't be ignored. Painful or tender. Pain in a mole can be a sign of inflammation or other underlying issues that need to be checked by a professional. A mole that bleeds, oozes, or develops a sore. These symptoms can indicate that the mole is not healing properly and could be a sign of a more serious condition. A mole that changes in texture. If a mole that was once smooth becomes rough or bumpy, it could be a sign of a problem. Becoming scaly, rough, or bumpy. These changes in texture can be a sign that the mole is undergoing changes that need to be evaluated. If you notice any of these changes, don't hesitate to make an appointment with a dermatologist. Early detection and treatment are crucial for the best outcomes. It's always better to err on the side of caution when it comes to your skin health. Regular checkups with a dermatologist can help catch any potential issues early, ensuring that you maintain healthy skin. Remember, your skin is your body's largest organ, and taking care of it is essential for your overall health and well-being. So, keep an eye on your moles and consult a dermatologist if you notice any changes. Your skin will thank you for it. Protecting your skin from the sun's harmful ultraviolet rays is essential in preventing skin cancer, including melanoma. Follow these tips. Seek shade, especially during midday hours. Wear protective clothing, such as long sleeves, pants, a wide-brimmed hat, and sunglasses. Use sunscreen with an SPF of 30 or higher, even on cloudy days. Avoid tanning beds and sun lamps. Remember, prevention is always better than cure. By taking steps to protect your skin, you can significantly reduce your risk of developing skin cancer. If you have any concerns about your moles, don't hesitate to seek professional advice from a dermatologist. A dermatologist can examine your moles, determine if they are benign or atypical, and recommend the best course of action. Remember, early detection is crucial when it comes to skin cancer. By being proactive about your skin health, you can ensure any potential issues are addressed promptly and effectively.